Okay, so this is a video where I'm specifically going to talk about how my son was diagnosed with Marfan's and how it's hereditary, what symptoms he has, what symptoms I have. So, he's had symptoms all his life, but we never realized what these symptoms were for or connected the dots. All these different odd symptoms he's had over the years and how no one's ever put them together as Marfan syndrome or a connective tissue disorder. So the first thing that I noticed was, um, well, I didn't think anything of it. When he was born, he had very long, thin fingers. And so does my daughter when she was born in 2008. And I've always been tall and skinny. So with my son, what happened with him was, he had these long, thin fingers. Again, that's normal. That's what I had. I didn't think there was an issue with it. And the reason I'm bringing it up now is when my daughter was born in 2008, she had the same thing, and people would say, oh, somebody better buy her a piano. Look at those piano fingers. And so it triggered this thought with my now daughter that, okay, maybe she has this as well. So my son, after he was born, he was chubby as a baby. I breastfed, and he had a very healthy baby weight, and the pregnancy was normal. Delivery was, he was uh, 2 to 3 weeks overdue and induced because they induced it because he was overdue and they didn't want him to get any bigger. He was 6 pounds 9 ounces, 21 inches long, um, which was longer than average, I guess. And it was a healthy, normal delivery. I had an issue where the placenta didn't detach. So right after delivery, the my obstetrician had to he had to remove the placenta because it wasn't removing on its own. So he removed that, um, and then that was it. Then it was normal. The hospital stay was normal. He had some jaundice, which is fairly common, um, but it didn't require any medical intervention, and it went away. It went away on its own. And then the next thing I noticed was when he was about 4 years old, I noticed his sternum was starting to appear dented in. And um, it was getting pretty deep. And what it looked like to me was the sternum was denting in and one side of his rib cage was going out. Like he had this asymmetric rib cage thing going on. So I was worried that maybe it was affecting his heart or his lungs because it was so getting so deep. So the pediatrician referred him to a cardiologist, and at that time they did an echocardiogram on his heart when he was 4 years old. His heart functions were normal. All his heart measurements were normal. He didn't have any aortic root dilation at that time yet. And the cardiologist said she wasn't worried about his heart, that what was going on was his sternum was indented, so his heart was going over his heart and his lung was getting a little squished, but nothing severe at all, and it was going into his left side of his chest, and the ribs were growing out to accommodate his organs getting pushed to that side a little bit. She said, it's fine. There's nothing wrong. it's not suppressing anything. That, there's a surgery they do with this bar to get the sternum to go out, but it's purely cosmetic. It's not needed. So looking into that surgery, I said, I'm not putting my son through that. You can look through the surgery. I'll put a link up here to talk about that surgery. But since it was cosmetic, I didn't think it was something he needed. And it's such an invasive, rough surgery with such a long recovery. And he wasn't at that time worried about how he looked. So I couldn't see putting him through that. And at that time, the cardiologist said he will have breathing issues from his lungs being suppressed way before he has any heart symptoms. So I was like, okay. So she said, let's just, we'll keep an eye on him and figure out if he has any lung issues in the future or any heart issues. So he didn't have any issues. And then he grew into his teens, and his chest was getting more deep, more inverted, to the point where he was getting very self-conscious about it. He still didn't want surgery. He dealt with the his insecurities, I guess. I could say he was very self-conscious about it, where he'd go to the beach and he wanted to wear a shirt. He wouldn't take his shirt off if he was at a beach or at a pool. And he was looking very tall and very skinny, looking underweight, which is how I looked when I was younger. And when I was in high school, I was made fun of because I was so skinny. When I was a child, my grandmother accused my mom of not feeding me because I was very, very tall and skinny. And I'll put a picture. I'll see if I can insert a picture of how I looked when I was younger. And that's how my son was looking. And when I was in high school, people would make fun of me for being skinny. People would call me Skinny Bones Jones, or Chicken Legs, or Twig. And it was very hurtful. And I would overeat to try to gain weight, and I just couldn't gain weight. As much as I would eat and eat and eat, I could not gain weight. I was just bound to be tall and skinny and didn't know why. And apparently with connective tissue disorders and Marfan's, you're tall and lanky a lot of times, and that's just how your body is. But again, I didn't know. I didn't know that was an issue. At this time in high school, my sister, who was also tall and lanky, had a collapsed lung, and she had a few in her lifetime. And when I gave birth to my son, she actually the next day was having surgery on her, what I think was her third collapsed lung. And again, she wasn't diagnosed with any connective tissue disorder or anything. She just had a spontaneous collapsed lung, and I guess her lung doctor was scheduling surgery, not thinking that she had any hereditary issue that led to this, not diagnosing anything anyway. So let me see. So my son's teen years, he was in probably 10th grade. He had his first girlfriend, and I was cutting his hair for him. And when I was done cutting his hair, I said, here, take your t-shirt off. Let's shake off your shirt. So he took his shirt off, and for the first time since he was, I don't know, since he was like 5 or 6, because I used to bathe him when he was little, but then he started bathing himself, and he wearing his shirt all the time, and I just wasn't seeing his body. So he took off his shirt, and for the first time since he was 6 or so, I saw his back. And what I saw were these horizontal, they looked like burn scars or whipping scars. he had these purple marks. I didn't know what the heck they were. I was just shocked. I thought, he's got scars on his back. Is someone torturing him? Did someone hurt him and he doesn't want me to know? And I just said, oh my God, Trev, what happened to your back? And he's like, what do you mean? I said, you have bruises or something. You have marks on your back. They look like scars. Did someone hurt you? Is someone hurting you? And he's like, Mom, you're scaring me. What are you talking about? What's on my back? Because he wasn't aware, because you don't look at your own back. And apparently no one's ever told him about it because maybe no one else saw it. So there were just all these lines on his back. And it just so happened that we were going to a dermatologist that week for his acne. He had some acne. And when we were at the dermatologist, I said, can you look at his back and tell me what you think this is? Because he's saying nothing happened and he doesn't know what this is. And the dermatologist looked at it and she said, it looks like stretch marks to me. I think it's stretch marks. I don't think it's bruising or anything. It looks like stretch marks. Has he recently gained or lost weight? And I said, no, he's always been very thin. And she said, well, it's definitely stretch marks. And I'm thinking, she said she was thinking maybe because he grew so tall so quick that maybe he got stretch marks on his back. She couldn't really explain it, but that was her best way of explaining it. Later, when I would find out, it was a Marfan syndrome symptom. But at the time, again, we weren't connecting it with anything. So then go forward to, he is about, I want to say, 17 years old. Maybe he just turned, yeah, he was 17 years old. And he wasn't having any other symptoms. What was going on in our lives is my older sister my younger sister that had the collapsed lungs called me because she had just been to the emergency room with her son, who's also tall and skinny, and he was at the hospital having a collapsed lung. So the doctor in the ER evaluating him, looking at him, looking at his tall lankiness, his collapsed lung, having his mother's history of her collapsed lung, this ER doctor says, has anyone in your family ever been diagnosed with Marfan syndrome? And my sister's like, no, what's that? So he was telling her about what it is, and here's a link to marfans.org. I think it's marfansyndrome.org, so you could see what the symptoms are. But the doctor explained what it was, and he said, does anyone else in your family have collapsed lungs? Does anyone have a sunken chest? And so the sunken chest, she's like, yeah, my nephew, my son has this sunken chest. So she called me to tell me about this syndrome, and I'm looking at the symptoms, and some things are really hitting home, and I'm starting to connect dots. He's got these stretch marks on his back. He's tall and lanky. He has the inverted chest. He was diagnosed with mild scoliosis. He has the rib cage asymmetry. He, in 10th, was it 9th grade? I think in 9th grade, he was having some double vision, which has to do with the connective tissues in the eye, not holding the eye exactly where it should be, so they're a little askew, and he was having some double vision associated with that he did some eye exercises to build up muscles and tissues, and that's gone away. But it's something he had that we didn't connect with this. So he was having those symptoms, and the severe issue, the main issue you could have with this, and the scary thing is that you need to get checked out, is to have an echocardiogram and to get your heart checked out to see if you're having any heart issues. So I talked to his pediatrician. She looked over all his symptoms. She said, yeah, you know what? It could be Marfan's. Let's get this checked out. So we went to a cardiologist. She did a echocardiogram, a pediatric cardiologist, and sure enough, his aortic root is dilated, which means that this aortic root, let me see, do I have my picture? I have this diagram from a couple of my other videos. So this is his aorta. I'm thinking it's this is the aortic root. I'm not positive. There's an ascending and a descending because this arrow's here. I'm thinking that's the ascending, and I think that's where his root is enlarged. So it's the connective tissues are, from what I'm reading and understanding from the cardiologist, they're thinner, and the blood going through this aortic root is, instead of a normal aortic root, it's wider and it's thin. So what happens is when it's wide and thin to a certain point, it gets very weak and is at risk of rupturing. And I have had a cousin of mine die from an aortic root dissection. And I'm going to have another video talking about what happened with him. But at the time, he wasn't diagnosed, and no one had a clue that this was an issue. So my son's cardiologist said, it's enlarged. Right now, it's at, I don't know, it was like, I don't remember what his exact measurements were, but it was dilated to the point where she wanted to suppress his activities. So she said no heavy lifting, no contact sports, like no lifting above 30 pounds, which also no pushing, pulling, or lifting, no contact sports, and let's just recheck him every 6 months. So she rechecked him, and his aortic root is staying the same, and he's had it checked twice since, and it's still not enlarging. It's still exactly the same. So he does have a a medical alert necklace that just says his aortic valve is dilated, or not valve, his aortic root is dilated. So if something happens, they'll know to check his heart right away. So I think that's it for my son. He did go to a genetics counselor, and there were 3 or 4 genetic tests she did that had to do with the fibrillin gene. He did not test positive for those gene deformities. Gene, what's it called? I can't think of what it's called, but she said based on all his symptoms, based on the Ghent criteria, he did have enough symptoms that they could diagnose him with Marfan's. They just don't know which gene mutation he has because it's not coming out positive for the gene mutations they know of. So they want us to go back every year to see if any other gene mutations were found, to get to know what gene is mutated, causing this Marfan's and connective tissue disorder. So based on the Ghent criteria, he does have it. So his symptoms, one that she saw with his the genetics counselor, are, I should pause this and just pull it up because I wrote down what all the symptoms are, but his skull is long, and I forget the term. So I'm going to list over here the different things in text. One of them, that his eyes were deep set, the mylar bones are flattened mylar, a long abnormally long skull. Um, I have all those symptoms as well. Um, his, I'm just going through the body thinking he has sinus issues. I've read some on Marfan's that that's related, but some say it's not. So, I've read various things on that. Heart issues. He doesn't have mitral valve, but I have mitral valve prolapse and regurgitation, which now even makes him more, because he has relatives with these Marfan symptoms of mitral valve. That's another thing on the list that says he could have it. He has the aortic root is dilated. He has the thumb and wrist sign, as do I. These should not overlap. Some people don't touch, some people touch. Ours overlap. Um, Mine doesn't overlap that much, but it shouldn't overlap at all. His overlaps to the point where his pinky actually goes to like that first knuckle in his thumb. His measurements of your ratio from your palm to your fingertips should be 50-50, I think. And there was something in his report that his was past that ratio. Um, his arm length, they say your arm length is longer than your height sometimes with Marfan's. His is not. He has a normal, I mean, yeah, he's tall and lanky, but his arms are not longer than his height. Since a baby, his height is always off the charts compared to his weight. Um, he has mild scoliosis. He has the rib deformity, asymmetry, and the inverted sternum. Um, Let me see. I don't have scoliosis. I don't have an inverted sternum or sticking out sternum. Um, arm extension, hypermobile something, and I'll add it to the list. Like his joints are very loose. He's very, very flexible to the point where it's extreme. His thumb bends backwards. Mine doesn't. His wrist will bend backwards farther than mine. Some people with Marfan's actually can touch that, which is crazy. His isn't that flexible. My sister can do this weird thing, the sister with the collapsed lung, where she can like touch the back of her arm where her backbone like sticks out really far and does this weird thing. We always called it a chicken bone, like make your chicken bone stick out. It was just odd that this hypermobility that she had that, at the time we didn't know was related to a connective tissue disorder. Going down, I'm thinking of other symptoms. My knees always click and lock, and my kneecap isn't held in place correctly. I was diagnosed with osteoarthritis and rheumatoid arthritis. Again, another symptom of Marfan's, but we didn't connect it with anything at the time. There's my legs in the back, and I'm not sure if he has this. He doesn't have this deformity, but I do. My heels, and I'll add a picture. My heels, the back of my heels, they should be like this, my heel to my leg, but mine kind of dent in. Some people dent out, but there's an angle there that is not normal that people with Marfan's or connective tissue disorders sometimes have. My toes are very long. My feet are very long. My son and I do not have flat feet. Some people have flat feet. We both have an arch to our foot. And I think that's it for symptoms. So that's it to the extent of our Marfans. I'm reading his report. His hypermobility is mild to moderate. Um, the skull things. It's called, and I'll write it, dosiocephaly is what he has. And stretch marks. That's it. So I said everything. I'm reading his report. He has everything else that's listed. So I'm going to talk about his genetic testing. What they tested was they tested for FBN1, which is the fibrillin 1, TG fibrillin 1, TG fibrillin 2. So those are the only three things that they tested for. Also looking for Loeys-Dietz syndrome. And that's it. That's what they tested for. They didn't test for anything else at that time. We're going back for a revisit for him with a cardiologist, probably with, or not cardiologist, a genetics counselor for adults, because now he's 20. And we're going back within the next couple months so they can retest to see if he has any other symptoms and to see if they found any genetic disorders since he's been there last that now they could positively identify in DNA tests for him. At the time, he was, let me see. I'm looking to see his height and everything at the time of his genetic tests, and it says he was 5'11" at the time of this test, which was 2 years ago. I'm looking for a date. You think this would have a date? I'm sure it does. Okay, November 2013. He was measured and was 5'11". He's now 20 years old and is 6'3". So you can look to see if that's how abnormally tall he is, and he's still growing. He's got like size 13 shoe. His weight at this time was, when he was 5'11", his weight was 115 pounds. I don't know what his weight is now. I'll have to ask him, and I'll put it in the text. And that's it. So I know this is a long video. I'm sorry. I just want to explain the Marfan's diagnosis and his evaluation. So when we go back to the new genetics counselor in a few months, I'll post an update on his situation on the Marfans. Thanks for watching. Bye.